Welcome to the Wednesday, April 22nd edition of the Daily Situation Report for Thunder Bay Regional Health Sciences Centre's COVID-19 response. My name is Tracie Smith and I am here with Incident Manager Dr. Stewart Kennedy. Dr. Kennedy, we are beginning to see the benefits of increased COVID-19 testing in our community. What can you share?
Yes, Tracy. So at this stage, we've done almost 1,300 tests here at the Thunder Bay Regional Hospital, which includes our assessment center, the emergency, and the inpatients. I know public health and the community paramedics have done 300 to 400 at least. I think they're even more than that. So we got a total of at least 1,700 done in the community. And that has allowed us to just get a better indication of the amount of COVID-19 in the community. And I think from that perspective, we're doing a great job at not seeing a rapid influx of COVID-19 patients. As you know, this morning we've had 5 confirmed cases in our hospital. 2 still in the ICU and 3 in the COVID-19 unit. We have now 22 presumptive cases, which has been down from the past, which is good, all based on enhanced turnaround time. And we have very few staff off work because of exposure and having symptoms, because again, we're getting that rapid turnaround time that has been so important to move to increased testing. And we still have to do more increased testing. I mean, we still need to, the Ontario Health Guideline there, they want us to do more sort of testing, especially for vulnerable populations, and we're doing more in our hemodialysis unit. We're doing more in our emergency department, especially for patients who have to be discharged back to the community who can't self-isolate. So we're doing more and more in a calculated amount. And we also have better access now to in-house testing. We got some more test kits delivered, and now we have increased capacity to do in-house testing. So everything is going in the right direction. I think we would love eventually to begin looking at doing some asymptomatic testing to look at the prevalence in the community. But I think all the testing we're doing now through public health, as well as to the increased testing we do here at the hospital, will actually position us better to get a better sort of idea about the prevalence in the community.
So that's a really positive change from where we were a week or 2 ago.
Oh, absolutely. And again, I think, as I said yesterday, the capacity has really increased, because that's because all levels of governments have sat down and we've had that ability for increased testing. And just yesterday had a teleconference with all the sort of political sort of representatives in Thunder Bay, which included Michael Gravel. It certainly included our mayor and his representative. It included Judith Monteith-Farrell, and it included Marcus Plowski and representatives of Patty Harger's office. So we're all working in a coordinated effort, and that was perfect with just updating the politicians if there's anything else more they can do for Thunder Bay Regional Hospital and the community. And at this point in time, I felt reassured that we're doing all we can, and they're standing by to help us at any time.
That's great to hear that collaboration is making a difference.
Yep.
Now, as you know, in response to the COVID-19 pandemic, our hospital canceled elective surgeries and non-essential services. And you've spoken about a need to begin to reintroduce some of those services. What specifically is happening?
So just to be clear, we still are not doing any elective surgeries. We have put a recovery team in place, and we had delayed some lower priority surgeries, but that's been for over 4 to 5 weeks now. So those priority surgeries are being looked at right now by our surgical team, and we need to get those sort of patients into the hospital so the disease doesn't progress. So again, it's not elective, it was lower priority, and we need to start looking at those both procedures, as well as we have to enhance our diagnostics capability to look at different types of diseases that are progressing in these patients that we need to get in and get assessed, actually. But that's led by our recovery team, and they're actually going through all the required sort of services that need to begin to build up in the capacity that is both controllable and respectful of the guidelines outlined by Ontario Health North and the Ministry of Health.
Okay, so if there's a patient at home who's waiting on word, what should they expect?
It all depends on how urgent their surgery is considered by their attending physician and their attending surgeon. And if they're on the priority list, the surgical team will review things, and the office will get back to them about their upcoming surgery. But I wouldn't flood the sort of physicians' offices with phone calls. They know the priorities, and they'll go through a very sort of logical and sort of a set of parameters that require the urgent surgery to get into the hospital for their attention.
Okay, so thank you for clarifying that. We're not ramping up just yet.
Right, and just one other thing is all surgery in the patient's mind is urgent, but we have to sort of rely on the experts to decide how high the priority is.
Okay, so wait to hear from your physician.
Wait to hear from your physician.
Okay, thank you. Now, as you know also, many hospital staff and professional staff here, they have an increased workload as a result of the pandemic. Many of them are working longer hours than usual, a lot of extra pressures and stress. There are supports available to them. Can you speak to what those are and why it's important to put these in place?
Yes, absolutely. So I first like to say is I did a walk around yesterday to the ICU, which is a high-risk department, to the emergency again, which is a high-risk department, and to the 3A COVID unit, which is a high-risk department. But every department here, every location in the hospital is a high-risk environment right now. And as I walked through, I was just amazed regarding the calmness of all our health professionals. When I talk about health professionals, I just don't talk about nurses and physicians. I know I say that a lot, but I'm talking about the respiratory technologists. I'm talking about the physiotherapists, the occupational therapists, the discharge planners, the housekeepers, the dietary aides, the portering. They're so the environment is so calm right now. It's refreshing to see. This is how hospital care should take place. This is how it'd be lovely to run a hospital at 70% capacity all the time, because then you have enough staff to deal with all the needs of the patients. I mean, and it's not only the decrease in occupancy. I think patients too realize they're not overburdening the system either. But the care you get right now, unfortunately, it took a pandemic to bring, all of us to a realization that it's best to work in an environment where you're not overcrowded. And certainly, if you come to the hospital now, you're going to get absolutely amazing care. The calmness, the stress level regarding patient care and delivery of services is really quite rewarding to see, and that's the way medical care should be delivered. But there's still, don't make it wrong, there's still a lot of stress regarding COVID-19 and the anxiety, and the workers need our support. And certainly we are stepping up during these challenging times to address their needs. And a few examples, we have psychological first aid offered to our employees for those who are feeling stress and anxiety. We're looking at select grocery items in the cafeteria that they can bring home because they can't get to the grocery stores. We're looking at things in the community for community supports for our employees. And again, we are giving out the cloth mask to protect our employees from spreading the disease among themselves. So I must say everybody is stepping up. And I must apologize to the hospital staff. I mean, you're probably getting inundated with memo after memo after memo, and even I have a hard time keeping them straight. So I understand how the amount of information coming to our staff can be overwhelming. And sometimes we change, unfortunately, on a daily basis, and because we're getting new evidence. And sometimes we make mistakes because we're making decisions so rapidly. But the mistakes are not to harm the patients or harm the staff. They're really based on as best scientific evidence as we can have. But again, I want to thank the staff for their tolerance of the IMS structure and the IMS team. It's very rewarding because they all seem to be understanding.
Yeah, the staff have been really patient with the outflow of information, changing information, as you said. There's really no COVID-19 playbook that we're following, is there?
None at all. We do have our pandemic plan, but that's 2017, and this strategy we're following it doesn't follow even that plan. But it's a guideline, so it's a challenging time. But I must say, everybody is stepping up in more understanding and kind than I could ever envision.
Well, it's really great to see all of the effort and work behind making sure supports are in place for staff and professional staff.
Absolutely.
Okay. Well, thank you for joining us today. We'll see you again tomorrow.